let you know I'm going live on YouTube since we are live streaming this
Okay,
still.
we weren't earlier though.
No, I'm just right now.
Thank you.
I can let you know.
Yes, please, I don't need to air my whole. You guys are okay, but not. All right, I'd like to call to order the budget committee meeting for the Adams Board of Tuscarawas in Carroll County, June 16th, 2021. If you'll please refer to your board packet. Our first item of business is the review and approval of expenditures for June 2021, and those are on pages 10 and 11. Hopefully you've had a chance to look at these prior to the meeting. Michelle, are there any items on the list of bills that you want to draw attention to?
They're pretty much their standard bills. The only thing is that we did have some expenses in the RSP, public relations grant, and also the SOAR 2.0. If you look at page 10, the very bottom, 731 SOAR, SOAR, that's just the main expenses for the court. And on page 11, you'll see 741 and then 741 SOAR 2 for Barnes, JR and Jones, just related to the grant. And we're doing stuff with it.
Yeah,
We're spending some.
good. Okay. All right, any questions from committee members about any of the items on the bill? If there are none, we'll need a motion and a second to make our recommendation.
Werther's,
Werther's, is that?
yeah, Werther's woodworking.
Oh, it is a board, like a board, yeah.
Recognition.
Am I able to make a motion on this, since we have new Philly Health Department?
You're not on the health department board or anything. Yeah.
Okay,
I'll make a motion.
okay, thanks, Paul. Anyone else? Mark, okay, so we have a motion and a second to approve the list of bills in the amount of $259,859.62. All those in favor, please say aye.
Aye.
Any opposed? Any abstentions? Motion carried. Okay, moving on to pages 12 through 15 in the packet are the financial statements through May 31st. When you look at the overall revenue of 88.45%, and then the expenditures or expenses of 77.71%, that seems to be at a pretty good place for this point in the year, because we'll still get more bills from the agencies coming up in the next few months. Are there things that on that statement that you think that we should review in more detail, Michelle?
Well, you can see that most of the revenue coming from the State Department is pretty much in at 100%.
No.
The things that aren't in at 100% are either reimbursements that we have to request the money for, or some of the funds we did actually receive in June, so they're not reflected on this May statement. So the money is definitely coming in, and we're good. And as far as the expenses, I think we're good. It's very hard to tell, only because you don't know the agency's holding back billings, and all of a sudden you'll have an influx. So that's the only variable in place, but it looks like.
Okay, but no areas in either side where we're anticipating or know about that we're going to be short in a certain area. Okay.
I just have a question about the HUD housing. That one is at zero, at 337,000. Is
That's
that
the budget remaining. That's our admin for providing the service Well, Mike provides the service, so that's his admin that he bills. 0 is the budget amount remaining because this is the month of June. So that's the end of our fiscal year. So this,
Oh, okay, so that's allocated then for the next
yeah,
year.
this is,
Okay,
we're paying, Metro or HUD payments. We usually pay June in the month of June, but then they're posted as May payables. So, but that's the end of the admin. So
okay.
there won't be any more this on that. Yeah.
Kelly, are you referring to the first item on page 15? Is that what you're-
No, I was on 13.
13?
It just shows the annual budget of 337,955, and then it has 0 that has been collected in revenue. So
Wait
not,
a minute, I'm on the same page.
So that's
Budgeted
budgeted
reserves.
reserves,
Budgeted reserve.
okay,
but the line right above it.
budgeted reserves with the line above it.
So you see.
Oh,
line-
yeah, I see that, okay.
So what that's saying is that we have not, at this point, had to plug in any of our
Any-
reserves.
Okay,
Michelle reminds me consistently, do not think that that's going to be the case. That is something that we really continue to monitor through the end of the fiscal year, so.
Continue to pay through the September board meeting, fiscal year 21 services.
Hey, guys.
Okay,
Hello.
you're back here.
Okay, any other questions on the financial statements? If there are none, then we would need a motion and a second to approve the financial statements as presented on page 12 through 15.
I motion that we approve those as presented.
Thanks, Kelly. Thanks, Jen. All those in favor, please say aye.
Aye.
Any opposed? Any abstentions? Motion carried. Then we have some meeting minutes. Should we review those now, Alan? Okay, from our meeting that we had on June 3rd. Those are on pages 16 and 17. And this isn't an action item, but I guess just if anyone has any questions, corrections, or feedback from that meeting. I thought everything looked like it was a good accounting of what we talked about. And then in our full meeting, we already reviewed this at the June 3rd meeting, that reserve summary. And then we are coming to the board already with our recommendations to approve E, F, and G from that meeting.
And just to let you know, Julie, we had talked in the past about the amount of information shared with the full board, not to keep anything from them, but just what the budget committee already works through and what level of fine detail they need. However, in case there is someone in the full board who wants more in-depth information before they would make a decision, we do have copies of that financing, that funding sheet that has it all broken down over here. And I do have copies of the full board budget that you all approved if they don't feel comfortable approving without seeing that minute detail. If they are comfortable with the budget's recommendation, I won't plan to pass them out.
Okay.
What about the change in the southeast?
You are like a plant, like I just had planted you there to ask that question purposely right now.
Was it on my notes somewhere?
No.
Are we on that agenda item?
Yeah, I guess, do you want us to go ahead and look at that today?
I didn't know if we
In
wanted to
this
look at the
meeting?
budget committee or wait till forward.
So I think that we can at least discuss it. We can at least discuss it here but we won't take a motion till we get to the full board because it will have to come from mental health and
Oh,
addiction
first.
to us.
Okay.
It's going to be very, what's the word I'm looking for? There's a lot of
Synchronized.
spinning plates today.
Synchronized.
Yeah.
Be in sync.
Sequencing.
Thank you,
Sequencing.
thank
There
you.
we go.
That's the
I knew
word.
that's word. A school guy.
That'll do it. So we had talked both at the Mental Health and Addiction Committee meeting and at our budget committee meeting that Southeast had not worked their claims through our billing process yet. So we did not put an FY '22 funding proposal forward. They have, and this was all documented in your notes. It is about 4,700 at this point in the fiscal year. Knowing this is new, knowing that they're still enrolling people, we felt like $10,000 was a reasonable place to start for '22. And so the board is bringing to committee the recommendation of $10,000 contract with Southeast for '22. The reason that's going to be important to the budget committee is you're going to have to look at the sheet that we did and feel comfortable identifying a space for $10,000. So as of right now, it potentially could come out of our unbudgeted reserves. And as Michelle and I have talked about quite a bit, there are still allocations that are trickling in that we didn't include in that budget outline, and we still covered our '22 budget. Does that make sense to everyone? Okay. So I guess the discussion on the table now, Julie, is that $10,000 for Southeast. If there are any questions? Okay.
Well, in last fiscal year, the one we're currently in, we allocated $43,000 to them, which they didn't use. So from that perspective, it makes sense that we would look at a more, is it annualized usage of how they use the money and reduce it. I don't, based on what we looked at on the 3rd, it doesn't seem a concern to me that we don't have the $10,000 to allocate to them. Do you guys have a concern with that?
No, I think the budget supports it.
Yeah,
Yeah.
I do too.
The 4,000 that was billed for, do we know what time period that was for?
So Danielle has been checking this regularly because we continue to say, has Southeast turned in any more billings? And it was from September. Their billings went back to September through, I think it's the end of May. And so it's a pretty thorough look at their fiscal year.
Okay.
And then do you have, from the claims, can you give us an idea of what kind of services are they making claims on? Is it psychiatry? Is it, because they asked for
Yeah, that's okay. That's okay.
some different types of, excuse me.
You know what? I can have Danielle grab that and bring it to the full board meeting. I didn't look at that level of claims data. You don't have access to that right now, do you?
Not immediately. I mean, we can tell you what the breakdown is for
Yeah.
every service.
I can tell you it's all mental health, but whether it's case management, counseling, or psychiatry, I can't. do that right now. I can tell you that. Read. Any other thoughts or questions about something?
So from our standpoint, it's really just to make sure that we feel comfortable with the budget supporting that 10,000, correct?
And since I'm just going to take over. Since we're not making a motion on that, I just wanted to let you know, when we met in early June, there was a lot of discussion about the budget requests and the crisis intervention budget requests specifically. You all charged me, and the Mental Health and Addiction Committee charged me with coming back with some data, some numbers, some charts. So we do have that. I'm going to, we have 15 minutes. Is that correct, right? Are you interested in seeing that now, before the full board meeting? Sure, she says.
Depends on if you're interested in repeating yourself.
Yeah.
And you are going to do it again in 10 minutes.
Well, I'm at least going to pass it out.
Sure.
And then, we'll see if you have any questions. I don't know why I gave you two, maybe for Julie. I'll go around.
We could save our questions for the full meeting.
Yeah, we could at least get to review it in
Yeah,
advance.
yeah.
there.
The benefits of being on the budget committee.
There we go.
I know. Thank you. So So there are two pieces of paper here, and they fundamentally share pretty much the same information. I just know that people like to see it presented differently. What this looks at is a very factual black and white numbers representation of how crisis services has changed and how our funding of crisis has changed. The graph you see on the front is connected to the numbers that you also see on page 2. So this shows, I'm just going to go over this really briefly. The bars are the number of crisis assessments that were done by community mental health care. So as you can see in 19, they did 424 crisis assessments, 426 in 20. And then the orange line is what we've paid for that service. So anytime someone without benefits has a crisis assessment, they bill the board. And we paid, you know, in 19, for example, we paid $108,000 every time they saw someone for a crisis intervention who didn't have benefits. I didn't say that correctly. We didn't pay $108,000 every time.
Yeah.
You know what I mean, Jen?
For the year,
Correct. Thank you.
Got it.
And so around that time is also when Cleveland Clinic started to do assessments in their ER. And so we saw the number of assessments increase, or we saw the number of assessments decrease and the subsidy request from CMH increase. And that last box is their request and projected number of units into fiscal year 22.
So 231 year to date, it's gone up a little bit since you and I last talked. And then they're thinking that's gonna almost double next year. Based on planning that they're doing, or just
I was questioning that too, like what makes them
347.
think they're gonna serve 347 this next year when this past year was very much a mental challenge for a lot of people. And Cleveland Union isn't going away, so I found that interesting. Did they give any rationale for that prediction of 347?
They did not. And you know, it's very much an estimate and pretty much an estimate. Do you have any questions about the information laid out differently? A little bit more information on the attached pages?
We don't have a way of knowing how many of those assessments were done by Union Hospital, correct? Because we don't fund them, so we have no way of knowing.
None of those.
Right, we know these
right,
are not.
right.
I'm just trying to put the whole picture together of
Right.
what it looks like.
Did the overall number of assessments of people in our community go up or
Or
down?
down, right.
Mhm.
But it's gone up.
We would anticipate, I think.
My
Do the total.
perspective is crisis intervention is in a crisis.
Pardon, can you repeat that?
Our crisis services is in a crisis of itself.
Mhm.
Much of what you described prior. Experience that on basis within our system. CMH is core, so I'm trying to be extremely politically correct. CMH is in a crisis because of our system of care was developed and implemented years ago when there was a partnership with Union Hospital. When CMH's budget got cut for whatever reason prior to me coming to the board, they lost 24 hours crisis intervention. To adapt to that, everybody was funneled to the ER. Once at the ER, they'd call an on-call crisis worker, and the on-call crisis worker would come and assess them in the ER. The clinic took over and said, hey, we have our own system of care. We're getting all these patients and clients dropped at our front door. We will assess them and everything else CMH. So we're seeing CMH. They're in a state of crisis. Our system of care for crisis is in a crisis situation. Because people are being referred to the ER for stabilization or for medical clearance with the anticipation that they're being sent to a stabilization unit and back they're being sent home back in the community. And then you have a whole cycle of this is a reflection of the crisis of our community.
Do we have any way to know if the assessors at Cleveland Clinic, that central intake that does the assessment, do they at times refer to the CSU? They do that placement?
Yes,
Okay.
they're gonna refer, it's typically going to go from then back to the social worker at Union, at the clinic, who is with the individual. So if they decline placement in a psychiatric facility, if they feel that it's not indicated, it comes back to the local social worker to make those referrals. It could be to the behavioral health center of the clinic, it could be to outpatient counseling, it could be to the crisis stabilization unit. You know, I agree with what Paul said. Veronica and I were at a meeting a week ago with Cleveland Clinic, CMH, and a handful of local law enforcement. And it's clear that over the course of the past year, there has been an increasing amount of stress and discord connected to the crisis system and the collaboration between CMH and law enforcement and the judicial system and the clinic. That needs addressed regardless of how this funding works out. And one of the things that we were talking about internally is perhaps identifying some funding to pull out to have a consultant come in and look at how we can rework our crisis system from a financial perspective, from a clinical perspective, and because I know Carroll County feels pretty uncomfortable with the way they're getting responded to right now as well.
Or not responded to. And it's, you know, it's again, a system problem, but it's, you know, limited support from law enforcement in Carroll County to assist, and just that not having on-site, you know, so everybody has to travel. And when individuals are in crisis, getting them to do that voluntarily is very difficult. And then when you don't have support from law enforcement to help with getting them into the system when they need that care, you know, and we're seeing it at the health department now that people are coming to us and wanting us to help with case management and that kind of stuff. And we just don't, that's not what we do, you know, we just don't have those resources. And so figuring out how does this work across both counties when we fund both counties?
It's just supposed to be working. There's supposed to be a satellite office in Carrollton.
There is, but they don't staff it. So when there's a crisis, they say you need to come to Dover.
Which is what they tell us to.
Yeah.
And then our consumers end up becoming a hot potato.
Right, yeah.
And it's jeopardizing people's welfare and safety, both the community and consumers. And I'm not exaggerating when I say the system is in a state of crisis. And working within the system, it is very frustrating and heartbreaking when you have to take somebody to the hospital against their will on a civil commitment. And oftentimes, before you're ending your shift, you see them walk in the streets. System broken. I don't fault CMH for this. CMH is trying to stay solvent And I don't fault where we are, because we have to be fiscally responsible also. I don't know what the answer is.
Go ahead, Jen.
I was just concerned about the other hospital in our county. You know, they don't have their own behavioral health system there. And obviously, like most hospitals, they've had a lot less ER visits throughout the pandemic. Now that everything's opening up, I mean, I remember, you know, working there 22 years, we had a lot of people coming in who were mentally unstable. And you're right, sometimes the officers would bring them in and then, you know, before I left work, go there, they were down the street again. Well, great, they're gonna be back in 2 days. You know, so, you know, what are ways that CMH can maybe interface with, you know, Trinity more? That might be something to look into, because since they don't have their own behavioral health setting, that might be with some of this projected growth, that could be a source.
And I apologize, Trinity was there as well,
Good.
but we spent so much time focusing on what is happening with the vast majority that we didn't get to Trinity, but they are on our agenda to make sure we discuss.
So the new administrator is excellent, Wayne Richardson, and it's, you know, that end of the county, you know, the people we serve there were a lot like Carroll County. You said you have to go to Dover, you know, they're just not gonna go. So,
Which Trinity, from my understanding from that meeting, and I wasn't present, I understand they will take law enforcement civil commitments. They don't have security there. I wanted to bring up, and I apologize for missing the budget committee meeting because I was injured. Is there a way we can send funding to Trinity to help offset some security costs?
Because we used to always call Denison Police Department.
Right,
And they
which-
would gratefully come down, but they don't have a huge police department, so that takes somebody off the street.
Julie, do you want, I
Yeah.
think we need to cover
I
this in
agree.
our full board this week, yeah.
Yeah. Okay, that's all very good discussion, and everybody brings a lot to the table. We'll discuss that further at our full board meeting. And so do I have a motion to adjourn this budget committee?